What's up, everybody? Welcome to Ask Our Vet live from the Earth Animal Studios. Welcome everybody in. This is our fourth episode of the second season. We are going to be talking today about dental health, okay, in our animals. February, as you may or may not know, is National Pet Dental Health or Pet Dental Awareness Month. It's something that's recognized all through the pet industry as well as veterinarians. So it's a good month to shine a light on the importance of veterinary health, obviously, I mean, of dental health. We are, our pets' mouths and the health of them is as important as people, as ours, right? And certainly if the mouth is thrown off balance, it can affect the rest of the body. So it's something that I think is important, something we want to talk about. All right. Hi, Morgan. Happy Thursday. Thanks for checking in. Hi, Good Fish. Hi, Nicole. Oh, yeah, Julie, you like the Keller Williams at the beginning? I thought so. That was a good one, right? Yeah, and Al, we're going to be talking, your dog just got a dental. We're going to be talking about that. Hi, Dee. We're going to be talking about that throughout this and talk about, kind of what basically our approach is going to be maintenance, okay? And what we do to just on a daily basis to help our pets, stay off dental disease, obviously, and have longer intervals between having dentals and things. And, and then get into the dentals themselves, okay? So, hi, Pat. Thanks for tuning in. How much snow did you get in New Jersey, Pat? I would imagine a lot. Oh, Kitty, yeah, you like this? I got some, I was at the Earth Animal store today, and I picked up some cool swag, so I thought I'd show off my mug. I don't think I should still be drinking coffee, but hey, why not? Oh, hey, Uncle Brian, thanks for tuning in. Hi, Nora. So anyway, we're going to start out with my Earth Animal of the Week. Every week, we all are Earth animals, right? So any given week, we could talk about an animal or a person or, something that, something I saw nationally or something locally. It could be really anything. This week, I wanted to touch on, I could not stay away from watching the pandas at the National Zoo play in the snow. To me, I'm not, people who know me know I'm not that either tech savvy, right? So I usually rely on my kids to kind of show me or send me or bring me these things. And my daughter brought it to my attention. And I'm sure everyone that's tuned in has seen it because obviously it went viral and it was all over the place. But to watch those pandas actually just get joy out of playing in the snow, to me was really super cool. I watched it a million times, and so I thought I'd call attention to it because to me, I couldn't get enough of it. Talk about bring a smile to your face, right? I thought that was really, really, really cool. Let's see who else is checking in here. Tasha, yeah, Dental Month is a big one. It is also, like, again, in the pet industry, it's a big month. Oh, thank you, Angel. It's best part of my Thursdays usually too. It's fun to again, I love doing this and love talking to you guys, so this is great. 30 inches of snow in New Jersey, huh, Patty? Woof. We got about over a foot here, even along the coast. So it was quite a storm we got, but it's behind us. Oh, thank you, Michael. I did get a haircut, so I don't know. I'm just trying to keep a little kempt. Earlier today, it didn't look as put together. So, all right, let's start getting into it. Let's see who else is checking in. Hi, Heather. Thank you for checking in. It's good to have you. All right, let's start talking about dental health. Okay, I think one of the things that I thought we'd first. We did another show earlier on last year about, we called it Anatomy of an Eater, right? But it was basically talking about the differences in what the dentition, what kind of teeth our companion animals have, right? And, obviously we have the straight up herbivores like horses have distinctly different teeth, right? But when we start to get into small animals, you start to get into really a cat's mouth and a dog's mouth are pretty vastly different, right? Dogs have 42 teeth. Cats have about 30 adult teeth. Okay, so just a difference in the number of teeth, right? And I have a model with me. I have a model of a dog dentition, and we're going to use it later and kind of throughout the talk today to show to show different things, show different teeth, show some techniques maybe on brushing we're going to get into, because, you know, and we want to obviously keep our pets' mouths looking like this and not the flip side, which we'll get into, which is this, right? So we'll talk about this. This will play a role in our talk today, okay? So again, difference in the pet's teeth, but our approach oftentimes with dogs and cats is similar, but a little bit, you know, a little different, obviously, because of how you have to approach them. But it's all for that common purpose of trying to keep as much tartar as we can from building up on their teeth over time, which then adversely affects the gum line, which then invites bacteria, and it's kind of a, you know, vicious cycle, right? All right, let's see. Hey, Oreo Pup, thanks for tuning in. All right, there you go. So Oreo Pup already chewing the no hide as we speak during the show. It's very topical. That's good. And we'll talk about that as well. Hey, Dad from South Carolina. Hi, Patty. Thanks for tuning in. All right, let's get into it. So let's start. Dental health care. When does it begin, right? Well, ideally with our pets, it starts when they're puppies and kittens, okay? And what I mean by that is not necessarily the dental care themselves. You know, remember, dogs and cats start losing their baby teeth, what they call their deciduous teeth, when they're about 4 months old, and they lose every single tooth from that 3.5 months till 6 months. So they replace every tooth in their head within 3 months, 3.5 months. So the goal at that stage, okay, is that what you really want to do with them is you want to get them used to. So the objective is, I talk to my clients all the time about, you know, kind of, you know, how we take care of our puppies and kittens and things to do. And one of the most important things that you can do when they're young like that is get them used to doing things on and to them, right? So you always want to play in their ears. Make sure that you can go in their ears. So later on when you have to clean their ears, it's not a big deal, right? You always want to handle their feet. That's a big one, right? So you handle their feet so you can cut their nails and play when you're sitting there, always touching their toes and playing with their toes. Well, mouths, right? You want to get your pet used to going into their mouth. So at that stage, we're not using any sort of toothbrush or anything else, just your fingers. But you want to get them used to lifting their lips, putting your finger in their mouth, opening their mouth. So it just becomes second nature that down the road, this is just something we do on a daily to every other day to a couple times a week basis, right? And by doing that, you're going to save yourself a lot of frustration when you're trying to do this down the road. And it's really important. And puppies and kittens are very, they get used to things very quickly. So when you handle them like that, they will become amenable to it really in a very short order of time. Plus the fact, if you're rubbing their gums with your fingers when they're teething, it actually feels good, okay? So it's a good time to get them used to it. Let's see who else is checking in. Hi, Candace. You're welcome, Candace. Thanks for... I get it. Yeah, for Bronson. So again, really important. Now, obviously, there's cases where that may not be able to happen. Rescue older dogs that you know, but you can certainly try and continue to kind of get any age animal used to it if you go slow enough and you continue to work on it. All right, very, very important. So I think that's the number one thing to do for these guys is just get them used to it to begin with. All right, I think we have a question. Let's see, Maureen. Maggie needs her teeth done. At 14, how dangerous is it? And they are not too bad. How do you get an older pet's teeth clean? Her breath now smells really bad sometimes, but not all the time. She hates her face confined. Okay. So Maureen, really good question, right? We are going to be talking about dentals later on, but just to tell you that, you know, obviously, when you're talking about dentals done in a veterinary hospital, anesthesia plays a role in it, right? What we use to do dentals is, we have a dental machine, we have a dental ultrasonic scaler that's water driven, water cooled, okay? And we have drills and we have polishers and we have the same stuff that you have that we all have at our human dentists, okay? But in order to use those, they need to be anesthetized, okay? And so your point and your question is at 14. Well, few things in that, right? Obviously, always when you're going to consider anesthesia in any of your animals, you do a workup first, right? You need to make sure that their core health is good, okay? Not all 14-year-olds are the same, obviously. There are some that have, some chronic illness that may not be good candidates for anesthesia. Some that have cardiac issues, right? Some that overall health-wise are good across the board. So while anesthesia, the risk obviously does go up with age, you have to do everything you can as a health professional, as a veterinarian, to mitigate that. And that's doing doing full blood work before you're going to do it. Really intensive full exams, okay? And just to make sure they're good otherwise. The other thing is our anesthesia protocols are so much better now than they used to be. Our options for shorter acting things and the gas anesthesias we use, and that, so the protocols are much, much better. So it's a very good question. I think the answer, we always talk about individuality here, right? And every pet's an individual, and it really is true. It's something that you hear Dr. Bob and Susan Goldstein talk about all the time, and it's something that I've really tried to do throughout my career. Every animal you have to look at as an individual. So there are some 14-year-olds that you may not want to put under anesthesia. There are others that you would. And it depends on the need, and it depends on what the level of tartar and dental disease is in the mouth. Okay, so really, really good question. Very good. All right, let's take another one or two and then we'll move on to some other questions before we move on with the subject. Hey, Vicky. Vicky says, I put my finger in Rocky's teeth and let him gum on my fingers. I actually stepped on 2 of his baby teeth, discarded a few days ago. He's almost 6 months, as you know. Right, and it is, they're like babies. When people come in and talk to me about their animal and their dog or their cat teething, they really teeth hard in that time frame. And it is important that you offer them things to chew on, because they're going to seek things out to chew on, right? So you're going to have to provide what you want them to chew on, and you're constantly, slippers are no good, right? The leg of the couch is no good. You want to make sure that you provide them with things to chew on, so that they're not going to seek other things out. All right, let's see. Ruth has a question. My dog just had a cleaning and a shell fracture was found, tooth removed. Due to COVID, I had to wait in the car, was sent home with 2 drugs, 1 an antibiotic. How important to give? Okay, another great question, right? And so one of the things when you have fractured teeth, okay, and let's see if we have any on our model, right? So we have, actually there are some examples of that. So let's take, and I don't know, again, what tooth it is, Ruth, if you're talking about the big premolar they have on top, which is what they call their carnasial tooth, okay? That's this, and this one obviously is the disease one. You can see the tartar on it. But fractures of teeth are fairly common in the veterinary world. Just from they may get little, you see when dogs chew on things, how they usually work it to the back to this big carnasial tooth, okay? This is actually, it looks like a big molar, but it's actually a premolar, okay? But it's a big, deep-rooted tooth, and they usually, if they're chewing on something, they work it back to that area. And it's not uncommon for them to do, what they do is they slab fracture, so they'll peel a piece off, okay? And the reason why they remove the tooth is sometimes if you go in there, they can break off enough where you have root exposure. And then you can get infection that goes up into it, which can go even as far as into the sinus, okay? So if they sent you home with it, I would give it. I think it is important to give because dental infections can go systemically, all right? So I would say follow their directions for sure, because they know, they were there, they saw what it looked like, all right? Oh, you're welcome, Maureen. Thanks. Yeah, Vicky, anything, certainly Kong is, and you could put, sometimes you can put some of their little treats in that, and that'll keep them busy for chewing on it. I love you too, Vicky. Thank you so much. All right. Let's go on to the next, let's talk tooth and teeth brushing. All right. A lot of people are a bit intimidated by this or think that it can't be done. And I think that if it's done in the right way, it is really an important tool for really slowing down progression and production of dental tartar and dental disease. Okay. So we talked about the first step is just getting them used to it, getting into their mouths and and then slowly then you start to introduce a toothbrush. Okay. Now, they make obviously regular toothbrushes for animals. I actually like finger brushes, all right, because they're a little less intimidating, okay? And if you worked if you've worked on your fingers going in their mouth, this is really just becomes an extension of your finger, so it does not bother them as much as sometimes just now you have a plastic, toothbrush that may be intimidating. So I do like the finger brushes, and they also make a wide variety of toothpastes, right? In all different flavors. They make them in chicken flavor. They make them in fish flavor, seafood flavor for cats. Okay, so there's a lot that so you have a lot of variety there, and a lot of times that does aid in it because some of them really like the taste of that. Now I will tell you that there are animals that do not like the taste of any of the toothpaste. That's okay. If you can't use the toothpaste, it's okay. Just the action of just the brushing does a lot. Okay, so that's really important. So don't give up just because if they're okay with just the brush on its own, just use the brush. Okay, so just to show you, on it, and I'm going to be doing this backwards because, again, but when you go in the mouth, okay, the key is what you want to do is circles. Okay, and you just massage right at the gum line along the teeth. So just circular motions down through, and you do the top and the bottom. Okay, now you want to avoid obviously getting in there and trying to pry their mouth. You just really want to get on the inside of the cheek, and just run it along the entire arcade of teeth. Okay, get as far as you can back. Do as much as you can, as much as they'll let you. Okay, I think that's. Anything is better. Anything is better than nothing. All right. So I do think brushing is important. Now, we all lead very busy lives. I get that. Okay. I completely understand that. And we say, look, I don't have time to do it every day. Okay, that's fine. You do it a couple times a week, once a week. Whatever you can do, it's going to help. And we're going to talk about obviously providing some other things that are going to help as well. But if you can do the brushing and you can start from the time they're small, get them used to it. And it just, believe me when I tell you, the clients that I see, their pets come in that they brush their teeth. It is a marked difference. It is a marked difference from not doing it at all. All right. Important if you can. Really, it's something that I would highly, highly recommend. All right, let's see who else is checking in. Hey, Gilda, thanks for tuning in. So, Tiffany, just what I was saying, right? I think, so Tiffany said, I heard that you don't need to brush the inside of the teeth, only the outside. Is that true? I think, look, if you could, that's great. But the problem is most animals, in order to get in the inside of their teeth, you have to open up their mouths. And a lot of them really start to get nervous if you start opening their mouths and going in. And I think you got to be careful because if you don't want to drop anything down the back of their throat or anything else. So I think really just what I was saying and going down, starting again on the inside of the lip, along the cheek, and just going like this and literally circular motion along. And I'm telling you, once they get used to that, a lot of them will enjoy it. They like it. It feels good to them. It massages their gums. It really helps their oral health. Okay. All right. So good question, Tiffany. All right, Angel has a question, and actually very, very timely because we're going to be getting into that. It's our next point here, Angel. Angel asks, are dental treats worth anything other than calories? i.e. greenies or Merrick Fresh Kisses. Okay, so my next topic here is providing chewing toys, chews for animals. Okay, anything that an animal chews that will help slide up and down the teeth as they chew it will help with, again, rubbing off, staying off that tartar. Okay, so certainly even things like no hides, right? All right, and we don't forget about the small dogs and cats too, right? That will chew on these. As they chew and as it softens and as it rubs, it will rub up down, and that also will help. So really, any quality chew treats will help with that. So to answer your question, yes, oftentimes they do help because they just slow progression. Okay. Now, as we say this, obviously none of this, most animals at some point in their lives, and some more than others and some less, will need, a dental at some point in their life. And again, we're going to talk about that a little later. Hi, John. Thanks for checking in. Hey, Martha. Thanks for joining us. Hey, Mona. Mona says hello from the UK. Thanks for tuning in, Mona. I appreciate it. So you asked about rabbits and do we need to brush their teeth and how? So it's a really good question, right? Rabbits are tough. Rabbits are tough. They have small mouths. The one thing that's important about rabbits, the key about rabbits, is the alignment of their front teeth. Okay, and providing them things to chew on to help wear those, because rabbits can get overgrowth of those teeth, what they call malocclusion, right? Which is where they can overgrow and they start not to be able to chew things correctly, and it can lead to all sorts of problems. So one of the things with rabbits you want to do is you do want to always watch those teeth and bring them to a veterinarian so they can be checked out regularly and look at those teeth. So that's really the key with rabbits. And again, rabbits as herbivores have different dentition, different dental arcade than our dogs and cats, right? All right, let's see. All right, Tiffany has a question. Do dental gels work, the ones that you just put on the teeth without brushing, or dental sprays? So I will tell you that there's a lot of those on the market, Tiffany, and I think that, again, I've seen some that work better than others. Okay, I do think that they do. The ones that some of them have merit, and they do. Just there's water additives and things like that, and a lot of times they help. Do they help as much as can they replace brushing or some of the chews? Probably not. Okay, but they do have a place, and I think when you start developing, when these things are all used in conjunction, then when you have a system, right? I do think that all together they can all they all help. All right, so that's a good question. Oh, you're welcome for the info, Sherry. Thanks for tuning in. So let's get back to chews, right? So we always talked about no hides. We talk about snacking with a purpose. When you give animals a high quality treat or snack, so I also think that you want to look at, well, we want to give them a treat. What kind of treats can we get that have purpose, right? That not only are they going to like, but that are going to be beneficial, right? So just example, like things like the herb tenders that we have, the chicken tenders, right? So the fresh, okay, parsley and mint in it, right? Freshens breath, great. They love these obviously, but as they chew these and as these get chewed, they will also help to a degree. They slide up the teeth, and anything that will do that, all right, will help. It all helps. All right, let's see. So Heather, to answer your question, yes, some of the water additives do help. Okay, we'll talk about. Let's see where I have it. So something like there are some great herbal stuff. Earth Animal has a clean mouth. Okay, gums and breath. Something like this is beneficial. It's got a few things in it that help, right? Chlorophyll. It's got sweet orange and grapefruit in it. Okay, and something like this also helps the inflammatory, like the natural inflammatory response to help soothe and comfort the gums as well, right? So this is a great one. And Dr. Goldstein developed this. I highly recommend it. And something that, again, goes back to that collection of daily oral care, right? So I think it's something like that would be great. All right. All right, let's see. Tasha, let's read Tasha's question, then we'll go on to the next. Let's see. Tasha says, raw bones treated and sold in the pet food sector for safety have been great. The power of live microbes, right? Absolutely, Tasha. I think, anything that you can do to add into that. One of the things you have to always be careful with some certain bones is, how hard they are, right? And so, not all bones are created equal. You have to be careful with, especially dogs that have some dental problems, as far as fracturing the teeth. So you have to be careful, but good point. Hey, Lynn, thank you. Thank you very much. Thanks for tuning in, Lynn. I hope you're doing well. So Lori, it's you guys are great today. You're asking these lead-in questions that I have for my presentation. So, and literally my next one is going to talk about kibble. So that's perfect. Lori asks, is kibble better for their teeth than wet food? And that is a question. First of all, great question. Okay. Second of all, I really do think that that is one of the most common questions that I get. Okay. And here's the answer, actually, simply no. And I'll tell you why. So kibble is, obviously it's it's extruded and cooked at high temperatures, and so it tends to be hard, right? Very hard. So when they do chew it, right, it breaks up, it powders. So it does not slide up and down. So you have to picture it, you picture as the dog is chewing it, right? And as it's going between the teeth, it's just powdering up and mashing. So it does not get up on the sides of the teeth, okay? So it really doesn't do a lot for oral health. The other thing you have to remember is, and if you've ever seen, which anybody who has pets has seen them, unfortunately, throw up after they eat, which is very true in cats, and oftentimes true in dogs. If they throw up, you notice the kibble looks almost identical to what it was in the bowl, because a lot of them don't even chew it, they swallow it. It's especially true in cats because cats are, again, obligate carnivores. Cats have less teeth, less surface for chewing, and really cats, wild cats are used to grabbing flesh and swallowing large chunks of flesh, so they really don't chew their food a lot, okay? So it really doesn't, and so it's a little counterintuitive, but it's and that was exactly going to be my next point, was that we can't assume that our dry food that our animals are eating is going to help their teeth, okay? You're very welcome, Heather. Thank you. All right, let's see. Obviously we covered the brushing, right? We covered getting them used to just, being in their mouths and manipulating things. We've covered the treats with a purpose, okay? Again, no hides, highly digestible. It's a great thing for them to chew on. That's going to help their teeth as well, right? Obviously, our tenders helps their breath, helps their teeth. Great snacking with a purpose, right? We've covered daily oral care with things. I think they put it up already. There's Earth Animal put it up, all right? With a clean mouth, gums, and breath, okay? So, how we've talked in the past about several things. You have this system. You have multiple things, multiple part things that go towards one goal. And so this is very similar to that. Every little thing helps. So we kind of stack these things, all right? All right. So one of the last things that I want to talk about dental health is the importance of, and certainly this is last, but definitely not least, okay? Doing home exams on your pet's mouths regularly and having them examined by the veterinarian at least annually, right? And more as they get older, right? And it's so important because part of the physical exam that I do and veterinarians do, yeah, Angel, I'll show that finger toothbrush in a sec. We'll go over that one more time. Part of what we do at part of our physical exam is we go through their whole mouth, Okay, and we look down both sides, open the mouth, and look in there. And so certainly veterinarians oftentimes can identify things that an owner might not be able to see, but it's super important. And what are we looking to? Okay, now obviously on this model, this is an extreme example. Okay, but what we're looking for is gingivitis, which is redness to the gums. Okay, healthy dog's mouth has little to no redness on the right along that line. Okay, right along that line of the teeth. You get gingivitis. So even a certain degree of redness, if you see that, may be indication of an early problem, and you should have the veterinarian check it out. Okay, what else are we looking for? You can see this brown this brown area right here. That's dental tartar, dental calculus, and this stuff is incredibly hard. It's like cement, okay? And once it starts building, it really kicks in and just starts to cake on itself. It's not always this dark. A lot of times it's light brown. It may get darker later on because of the addition of bacteria and all sorts of things. So very important you look for that, okay? And if you see anything that you think is out of the usual, or again, right, what's one of the telltale signs for our animals that they may have something going on in their mouth? Breath, right? We've used the term, sitting on the couch and sitting next to you and hot breathing you, right? It's true. And so, what that smell is an animal that has tartar, may have some gingivitis, and is starting to get a collection of bacteria, abnormal bacteria in that mouth that throws off an odor. Okay, so that's hugely important. And I think that having your veterinarian look on top of that, and just, again, at least once a year, and more often as they get older. Okay, now let's also talk. Well, let's answer a couple questions, and then we'll kind of finish up with talking about dentals, hand scaling versus full dentals, that sort of thing, because that's another question that a lot of people have. Okay, so Angel, I think you can do either way with disposable or washable. You certainly, just like us, can rinse it and wash it and use it again. Here, it's easier to show this. But obviously then, just like us, you have to throw it out at some point and get a new one. So anyway, one more time, just so here's the finger brush, right? Little bristles on. These are little soft rubber bristles. With or without toothpaste is okay. If they can tolerate the toothpaste, it is a little bit more, can be a little more effective because of the graininess of the toothpaste. But again, anything is better than nothing, right? So we come in, inside, the lip is hanging over this way, inside the lip, and you're just going to do small, kind of circular, just along the gum line, right? And that just stimulates it, it cleans it, stimulates the mouth to help itself. So it really is an effective tool. It really is. All right. I hope that helps. Let's see, Gilda. Yeah, cats always tend to have dental problems. Yeah, Gilda, this goes for both. That's why I was mentioning like smaller chews for cats. Same thing with kittens as dogs. Now, cats, typically, a lot of cats aren't as amenable sometimes at being in their mouths. But if you have them young, or you get them and you slowly work on it, it becomes routine. And once it's routine, they'll let you do it. So yes, certainly the brushing, chews with the cats. Even like so one of my cats has this little bird, this little soft bird that she carries around, okay? And she carries it all over the house. Even just her picking that up and chewing on that, even that cloth substrate, right? That's still sliding up and down her teeth. So every time, she makes a big deal about bringing it in every room and shows everybody, and that this happens every night, right? But she carries it all over, and literally, I mean, we do even wash it because they can get, if you ever see these things, that get saliva on them over and over, these pet toys, they have to be replaced from time to time because they can also be harboring bacteria, all right? So yeah, this is, cats too. Cats typically, we do a lot of dentals and things on both, but we certainly do a lot of cats, as you mentioned. So, Ruth, this is another really good question, right? Do you recommend a dental cleaning by a vet every year? And here's my answer. Some will need it every year, some don't. Okay. And it's just a matter of what their level of tartar is. Some of them, it is also amazing breed by breed, right? And this has always fascinated me about animals where just the shape of their mouths doesn't necessarily mean that they either will have good teeth or bad teeth, right? Let's take, for instance, greyhounds have these long, like majestic faces, right? Perfectly, oftentimes straight, these big straight teeth that, that are literally all in line, everything. Notoriously have bad teeth, notoriously. Have to do dentals on them a lot. They really, and then you have something like a bulldog, I've had bulldogs in the past, not one of their teeth lines up, okay? And they hardly have any tartar. So it really depends, again, as we talk about individuals. You do have some breed predilections for this, but the other thing is that it just, to me, it's individuals. And some, I saw a dog yesterday that had a dental cleaning last year that needs one again, just about a year, developing tartar, and that's that particular animal, and a propensity to develop more tartar. And the dog's owners are really good about dental care. Just this dog just needs it. So not all of them will need that every year. It's really personalized. All right, Patty, I'll have a schedule for her dental. Is there anything I can do for her prior to the appointment other than fasting to make it better for her? No, Patty, I think, obviously we'll take care of that on our end with, all the, again, right anesthetic protocols, the right pain relievers, whatever we need to do. So obviously fasting is key, because we want them to be fasted to go under anesthesia, but no, we'll handle that part of it. Good question, Patty. All right, so Teddy has a question. Teddy said, I get my Yorkie's teeth cleaned annually. I brush her teeth. She gets stuff in the water. She still came up with a gingival cyst. Yeah, again, when we start talking breeds, Teddy, if we talk about breeds, and I talk about breeds with dental predilections, Yorkies are one of the top ones that we do dentals on. And just as a breed, it is often their teeth are not great. I will tell you that but that doesn't mean you should give up on doing what you're doing, because honestly, you're still making a difference to some degree. Again, like I said, most animals at some point are going to need their teeth a dental, okay? And it's just a matter of how frequently, okay? But anything that we could do to increase the time frame between when they need one is important. So, it may be that you're in doing this, even though you're doing them annually and needing to do them annually, you're saving some teeth from getting cavities under the gums where they might have to be pulled. So keep doing what you're doing. You're making a difference. Sometimes it may not seem like that, but you are. Yeah, Lori, again, you're welcome on the information. And it does, look, I think people do think about the kibble for the teeth. And it does, when you think about it just on that level, it seems like it makes sense. But that really is a misnomer. That's not something that I find at all. So, hey, Teresa, thanks for tuning in. Yeah, Teresa, you like that product? I think it's a very good product. So, okay, here's another great question. Lori, good questions. What do you suggest for small dogs? Those finger brushes are pretty big. Yeah, I mean, they can come a little smaller than this, but some of them definitely are, especially when you have these little teacup. To be honest with you, even a gauze pad, I've used them on even a little gauze pad that you can get in there with your finger and just do that same motion in their mouth, and just that little abrasiveness of the gauze pad really can help. So just those little round or square gauze pads, I have people do that, and any little bit helps. All right. Yeah, it's, one of the things, so Teresa says, my vet frowned on me when I told him that my Goldens get raw bones for their teeth, right? You got to remember, Teresa, as veterinarians, sometimes we can be very cautious, right? Because we've seen, again, we talk about predictably unpredictable with pets, right? We've seen everything happen under the sun. So sometimes we may react when you say something like that, just because we've seen animals that have bones stuck in their stomach or or we've seen broken teeth and things like that. So it's just sometimes we may be, even me, get a little over dramatic when someone tells us something. It's only because, obviously we care for the pets, but the thing is again, we've seen everything under the sun at this point, right? Oreo Pup, let's get to the important question. How do I get my paw rinse and earth animal teacup like yours? They do have them at the Earth Animal store. I'm not sure. I don't know, because I just got mine. I don't know if they're available online. We'll have to check. But I got this one at the store in Southport, Connecticut. Or Tiffany. So here's the opposite question. You guys always great questions and so engaged. Thank you. Does wet food cause tartar? And again, I'll tell you, so just as dry food doesn't necessarily clean teeth very well, for the reasons we mentioned, I don't subscribe to the fact that wet food causes tartar, okay? It doesn't help it, right? Because there's nothing in it to do anything, but it does, I don't subscribe that it worsens it either, all right? So some grooming salons do ultrasonic teeth cleaning with no anesthesia. Is this type of cleaning at all effective? Okay, let's have a quick talk. Let's have a quick talk about the hand scaling versus full dentals, because I think this is an important thing, and I think people ask about this pretty often. All right, so the differences between, so some people say, well, I have someone that comes to the house that does some hand scaling, or I hand scale my pet's teeth. And certainly that has a place, okay? Animals that have minimal tartar, animals that, and that's part of something that could help stay off full dentals, okay? So certainly I do subscribe, and I know some people in the area, one person in particular that's just wonderful and does a wonderful job at it, okay? So certainly that has a place, absolutely. But the one thing is, and this person would tell you this too, is that there is a certain level of tartar or certain things that you can't accomplish with a hand scaling, okay? And really, again, oftentimes the whole problem is you can't see the whole problem, okay? There's tartar and infection, things like that, up under the gum line. So one of the things that you benefit from having a full dental is you can get up under the gum line to clean those areas, see if there's pocketing, see if there's, other disease. So full dentals under anesthesia is more, more comprehensive, okay? But there is a place for hand scaling as well, all right, and doing that, because it can kind of stay off having the full dental, and it could get small amounts of tartar off the teeth. So I think that it does have a place, yes. You're welcome, Patty. Hey, Stephanie, thanks for joining us. Oof. Yeah, that's a lot. That's a tough dental, and that's a tough mouth with that many extractions. My God. The gauze pad is a great thing, Teddy. So that's good. All right, let's see. So Nikki, I think obviously getting back to certain chews, I think you have to be, when you look at a chew, and here's another thing that we always say, so I want to make sure and say this. Anything that first of all, the key when you give your animal anything to chew on is to make sure the size of the chew matches the size of the animal, okay? You certainly, you don't want to give sticks or small chews to large dogs, right? You want to match the size, and you always want to watch your pet when they're chewing on these, okay? Again, no matter what, you want to be with them. So we don't use these things as pacifiers. We don't give them and walk away and leave them by themselves with them, because, again, with anything, these guys, dogs and cats, can get into trouble, okay? They can chew off too big a piece and try to swallow it. So you always should be around. I think, we always talk about the Earth Animal Chew School whenever we mention our no hide line, right? My dogs absolutely love the no hides, love them. And when we only ever give them to them when our family's in the den, they're with us, and we sit down, we give them to them, and we watch them. We all watch them. So it's really important, no matter what you use. Some bones do work better, some animals prefer certain ones, okay? And that's completely fine, but you have to watch them. And also make sure as you look in their mouth that they're not chewing things that are too hard, or they're not doing damage to their teeth, okay? And the other thing too is, one of the benefits for something like a no hide is its digestibility, right? Not only is it going to help the mouth, but as they chew pieces and swallow them, they're going to digest them. There's a lot of things on the market that are not digestible, or things that are going to piece off and just pass through them and go out, or too big a piece doesn't pass through them. And so you have to be really careful. Yeah, Stephanie, we talked about that earlier, about some of the dental chews. And I think, the bottom line is, yeah, I do think there's a place for them, because I think, again, do I think that any of these things, if used, prevent them from ever having a dental? No, oftentimes it doesn't. But what it will do is increase the time frame between the need for dentals, and just help with their overall oral health. Okay, so good question. All right, guys, let's see. We're at the, I think that's just about it. I think we covered pretty much everything. I have to tell you guys, the engagement today was great. The questions were really spot on. And that's what drives these, right, is the questions from you guys. So, and that's why I love doing this. I love kind of taking it in different directions. And I have to tell you, you guys are really knowledgeable and bring a lot to it. So keep tuning in and keep asking questions, because it really helps. It really does help. All right, so next week, same time, next Thursday, we're going to be doing, besides Pet Dental Awareness Month, or Health Month, this month, February, is also Responsible Pet Owners Month, right? And so we're going to talk next week about that human and animal bond, right? And what, from a veterinarian's perspective, kind of that relationship, and what each one gives to the other, and what ideally some things we can do to foster that, okay? Certainly pets are in our life to enrich our lives, right? But I fully feel that we have to go the extra step to enrich theirs, right? They give back to us unconditionally, and so I think we should be doing the same for them, right? So anyway, let's see. Oh, thanks, Good Fish. Thanks, Nicole. Thank you, Loretta. Thanks as always, Heather. Thanks for tuning in. Dee, thank you very much for tuning in. I appreciate it. All right, so that's next week. Please tune in 6 o'clock on Thursday. Let's see. We'll go out with a little. Oh, I think. I think there is a birthday from someone in this band, so I thought we'd go out with a little Spin Doctors. Anyway, all right, everybody. Stay healthy. Have a great weekend, and we'll talk next week. Thank you again.